So it's been really interesting actually hearing about the sort of voluntary sector perspective and then the public sector perspective. And I think one of the things that when I talk to people about complexity and commissioning and how we work with people in this really complex environment is that, well, actually, how does that really work on the ground? You know, how can we work as commissioners? People ask, because you know it's a competitive environment, and you know how can we develop things together that we then have to go out and tender for, and you know how can we commission something actually that we don't know what it is? You know, we don't know what it looks like. But I think one of our experiences in York actually has shown that you can do that. So Changing Lives works with people who are experiencing social exclusion, and what we try and do is help them to lead a fulfilling life, whatever that looks like for them. And we deliver a whole range of services, so homelessness, sexual exploitation, domestic abuse, employment, you know, and they all kind of get named after what funding stream they've come from. But fundamentally what we're about at Changing Lives is helping people to change their own lives. And last year we were successful in winning a tender in York. We've been working in York for 7 or 8 years, delivering recovery services on quite a small scale, and we won the whole system in partnership with Spectrum CIC. So it's quite a big contract for us, £1.5 million, and that money coming from the City Council and a small amount from the PCC. But what's really different about this contract is that what the City Council tendered for was a service to develop as the contract runs. So basically what they said is, we want you to run this service as it is now for the next year. What we want you to do in that year is then conduct a co-production exercise, so that in year 2 you can test out some new ways of working. And then we want to jointly write the specification, so for years 3 to 7 of the contract, that's what you'll be delivering. But also we'll build in that co-production into that specification, because actually, you know, we might test some stuff that works for a bit and then we want to change it again. What they didn't do is say what activities they want us to do, what specific staffing we might want in there, where we had to deliver from. What they said is, right, let's see how we can develop this together. And the tender document actually asks us about both our experience in delivering drug and alcohol services, as you would expect, we'll deliver a safe service, but also about how we go about the co-production, and what our vision was for moving the service to away from being centred on substances towards being centred on the person, and with a much, much stronger focus on recovery and helping people exit services and get back into their communities. So we've just got into year 2, so we're still doing this and learning about how we do it. And we have been through and continue to do this co-production phase. So that isn't just about consulting with people, so with the people who use the service, with stakeholders, with our commissioners and with our frontline workers as well as our managers. It's actually about working together to jointly work out where people are coming from, why things are the way they are, and then drawing up new activity models, testing those out, and then jointly assessing them how they work. And it's really all about us all learning together. That sounds lovely and idealistic. It's not been easy, I have to say. I think it's been really, really challenging. As we've heard, I think, throughout the morning, people are the system. So what we're doing when we're saying to frontline workers, right, how can we do this differently? What could be better? What they're hearing is, what you're doing is wrong. And so what we have to work really hard on that communication and hard actually on a bit of systems thinking skills. So trying to help people whose day-to-day job is supporting people to recover from addiction. We've also got to kind of upskill them in thinking about how the system works and which part you play in the system, and the fact that we are all part of this system. Because otherwise people get a bit demotivated, demoralised, and they feel criticised, and they retrench and say, well, we're not changing. So one of the really big bits of learning for us in this is about changing that environment and the culture. You know, recognising, as Toby mentioned, that intrinsic motivation of people, but also then actually making it really clear that, you know, we do have a culture of that. You know, being able to make mistakes. You know, you can make mistakes, you can try things, you can learn things. And what we need to make sure is that, you know, everybody kind of feels empowered to do that. So, you know, it's definitely been tricky. We've done it wrong sometimes. You know, we had a situation where there was lots of issues being flagged about the database, because that's a dead easy thing to do. And so someone kind of went running off and set up a working group about the database. And I was like, no, it's not about the database. The database is just part of that system. There's a whole load of other things that mean that you think you do too much paperwork, but it isn't about how the database works. So it's been challenging. It's not easy. It is messy. Our relationship with the Commissioner has been very important. The trust and communication there has been absolutely central. And we've done that quite formally through having a bit of a co-production strategy. So we've got our vision and our principles and our timelines in there. Because 2 years is not that long, really, to actually try and shift this whole system and try and, you know, really look at how we develop that new approach. But we've got to do it in that time. And there are some really exciting new things starting to be tested. We're starting to challenge that risk aversion of the drug and alcohol sector. So, you know what, if someone doesn't want to engage, then let's not make endless recovery coordination appointments for them that they don't turn up for. You know, let's make sure that they can access the clinical help that they need. And then we'll keep in touch with them by phone. Because then when they are ready, they know that they can get in touch with us and say, right, actually, do you know what, I do want to do something, I want to progress now. But rather than covering our backs by saying, well, they had all these appointments and they didn't come, then actually what we're saying is, come to us when you're ready. We'll put that harm reduction around you now. We're also delivering the homelessness services in York and really looking at the space in between those two services. So, you know, we know that a lot of people who are experiencing addictions also have issues in terms of housing. Most people in our homelessness services are also involved in our addiction services. And we're saying, actually, do you need a housing-related support worker and a recovery coordinator? Or could you just have one person? And could that be an asset coach that actually works on your strengths? So that feels as well like we're also starting to move a bit more into a place-based way of working with people with multiple and complex needs. So, you know, we're really trying to think about, well, how do people experience this system in its entirety? What is the system that person is involved in? And how can we make it simpler for them and actually get them through it and out of the other end and back into their communities? So I think, you know, in terms of what that means for the future, what our ambition is in York is to create that environment for people with addictions in York that meets their needs and aspirations and moves people out of services, and really embeds that co-production approach. And what I think one of the challenging things is we're kind of having to do co-production and learn about it as well as delivering the service. So, you know, it constantly changes even as we're trying to change it. So it's trying to capture that and recognise it as well and help stakeholders and frontline staff and the people who use services to understand that, yes, it will be changing and it might not change exactly how it looks on the action plan, but that's about it evolving and emerging. And I think there's still a long way to go in terms of, you know, our own services more widely. I think the commissioning and procurement environment, as we've talked about already today, is difficult at the moment in terms of actually stimulating and supporting that joint working and that collaboration, because I think that competition for resources in the voluntary sector means that actually collaboration is hard when you're trying to develop something really new and exciting, but you know at the end you're going to have to fight for your money. And so I think, you know, one of the things in York that helps us is having a 7-year, well, 5+2, but effectively a 7-year contract, which means that, you know, we're much freer to go, okay, you know, we've got this, as long as we do these things that we say, you know, the money's secure, we don't have to think about that. we can really think about working together jointly. And I think, Toby started off talking about bravery, and I think that's absolutely what it needs. It's that bravery and openness from everyone involved, and really kind of starting doing it, I think, as well. So I've heard somebody say, someone much more well-versed in systems thinking than me, say, to affect system change, you have to start somewhere and go everywhere. And I think what we've probably done is we started somewhere, but we've not yet gone everywhere, so watch this space.